Syphilis is a sexually transmitted infection (STI) caused by the bacterium Treponema pallidum. It can cause a wide range of symptoms and complications if left untreated. Syphilis is often referred to as the great imitator because its symptoms can mimic those of other diseases, making it crucial for early detection and treatment. Stages of syphilis. Syphilis progresses through 4 stages, each with its own set of symptoms. Primary syphilis symptoms. The primary symptom is a painless sore called a chancre, which typically appears at the site where the bacteria entered the body, commonly the genital areas, anus, or mouth. The sore usually heals within 3 to 6 weeks, even without treatment. Duration. This stage lasts for about 3 to 6 weeks. Secondary syphilis symptoms. This stage is characterized by skin rashes, mucous membrane lesions such as mucous membrane lesions in the mouth, and flu-like symptoms: fever, swollen lymph nodes, fatigue. The rash can cover large areas of the body and may be mistaken for other skin conditions. Duration. Secondary syphilis can last from a few weeks to several months. Latent syphilis symptoms. In this stage, there are no visible signs or symptoms. The infection remains in the body and can last 4 years. Latent syphilis occurs after the secondary stage if the infection is not treated. Duration. This stage can be indefinite, but approximately 1/3 of individuals will progress to the tertiary stage. Tertiary syphilis symptoms. This is the most severe stage and can occur years after the initial infection if left untreated. It can lead to serious complications affecting the heart, brain, and other organs. Symptoms may include severe cardiovascular problems, neurological issues such as syphilitic meningitis or tabes dorsalis, and dummus soft, tumor-like growths. Duration. This stage can occur 10 to 30 years after initial infection. Transmission. Syphilis is primarily transmitted through direct contact with a syphilis sore during sexual activity, which includes vaginal, anal, and oral sex. It can also be transmitted from an infected pregnant person to their baby, leading to congenital syphilis. Risk factors. Certain factors increase the risk of contracting syphilis, including having multiple sexual partners, engaging in unprotected sex, having a history of other sexually transmitted infections, being a man who has sex with men, having a weakened immune system. Diagnosis. Diagnosing syphilis typically involves physical examination. Healthcare provider will examine any sores or rashes. Blood tests. Serological tests are used to detect antibodies produced in response to the syphilis infection. Common tests include non-treponemal tests, e.g., RPR, VDRL. These tests measure antibodies that may indicate syphilis but are not specific to it. Treponemal tests. These tests are more specific for Treponema pallidum and confirm the diagnosis. Testing of source. If a chancre is present, the sample may be taken for laboratory analysis. Treatment. Syphilis is treatable, especially when caught early. The standard treatment is antibiotics. The primary treatment for all stages of syphilis is penicillin. Doses and duration depend on the stage of the infection. Primary and secondary syphilis. The single intramuscular injection of benzathine penicillin G is typically sufficient. Latent syphilis. Treatment may involve a series of injections over several weeks. Tertiary syphilis. More intensive treatment may be required, and additional medical management may be necessary for any complications. Prevention. Preventing syphilis involves several strategies. Practicing safe sex. Using condoms consistently and correctly can reduce the risk of transmission, although sores can be located in areas not covered by condoms. Regular STI screening. Regular testing for sexually transmitted infections is crucial, especially for individuals with multiple partners or those at higher risk. Open communication. Discussing sexual health and STI status with partners can help prevent the spread of syphilis and other STIs. Avoiding alcohol and drug use. Substance use can impair judgment and lead to risky sexual behaviors. Complications if left untreated. Syphilis can lead to severe complications, including neurological problems, including dementia, paralysis, and other brain-related issues. Cardiovascular issues, such as aortitis and aneurysms. Organ damage, affecting the liver, kidneys, and bones. Congenital syphilis. If a pregnant person has syphilis, the infection can be passed to the baby, leading to serious health issues, including stillbirth or developmental problems. Conclusion: syphilis is a serious but treatable STI that can have significant health implications if not addressed promptly. Early detection through testing and effective treatment with antibiotics can prevent complications and transmission. Practicing safe sex and engaging in open discussions about sexual health are vital steps in preventing syphilis and promoting overall well-being. If you suspect you may have syphilis or have been exposed, seek medical attention for evaluation and treatment.